All right, so a quick overview on stress disorders such as PTSD and acute stress disorders. They can be defined as anxiety disorders produced by an unusual or extremely stressful event. This can be assault, act of violence, rape, natural disasters, or even physical injury. It's basically anything that causes extreme stress or trauma that leads to these stress-related disorders that literally can be debilitating and even sometimes lifelong symptoms. So usually it's a stressor that is then perceived as a threat, and that causes your state of arousal and fear. So these responses can be physical, emotional, cognitive. Physical responses can be perspiration, quicker breathing, muscle tenses, heartbeat quickening, emotions such as horror, dread, panic, and cognitive disturbances in concentration and memory. So these feelings of fear and anxiety persist after an event is over, which is the key to PTSD right there. Okay, so what specifically happens in the body when we experience fear? I just wanted to go over this real quick so we kind of have a background knowledge when I go more into the stress disorders and what's actually going on physiologically with that. So the hypothalamus within the body controls the autonomic nervous system, which controls involuntary activities of the organs and includes the sympathetic and parasympathetic nervous system. Basically, so the autonomic nervous system is an extensive network of nerve fibers that connect the central nervous system, which is the brain and the spinal cord, to other organs in the body. This is basically what controls anything that you don't really have to think about to do. So your breathing, your heartbeat, all of that stuff that's necessary to survive, basically. And also, so the hypothalamus also controls your endocrine system, which is your hormones, everything like that. The endocrine system is a network of glands that's located throughout the body. So what happens when we experience fear? Basically, when you're experienced with a dangerous situation, anything basically that fear is going to kick in, your hypothalamus then excites the sympathetic nervous system. That causes our heartbeat to quicken, elicits feelings of fear, anxiety, and once that happens, these nerves stimulate your adrenal glands, and more specifically the adrenal medulla, and that causes neurotransmitters such as epinephrine and norepinephrine to be released. And once these are released, it kind of heightens their senses. And then the hypothalamus also goes back and stimulates the pituitary gland. And the pituitary gland secretes your hormone, the ACTH. It's also known as the body's major stress hormone. And this stimulates the adrenal cortex, and that releases corticosteroids, so basically cortisol. And all of this basically is your fight or flight reflex. So all of this is going on as soon as you feel fear, and that's your body's response to it. And of course, after it's all gone, fear is gone, your parasympathetic nervous system then takes over and it calms you down. So it slows down your heartbeat, slows down your breathing, all of that stuff. And if you take a look at this picture right here, it kind of just explains that. So you can see right over here, stressor right there, goes down to the hypothalamus, all the way down through your sympathetic nervous system, all that. At the same time, your pituitary glands are going too. So it's got those different branches in there that you can see. So take a look at that if you need to know anything else, but that's about it. Okay, so DSM-5 criteria for PTSD. This is the current DSM and what it says you need in order to be diagnosed with this specific stress disorder. So group A, so you need to actually experience exposure to an actual or threatened death, serious injury, sexual violence. And this doesn't necessarily have to be you experience it firsthand. You could be witnessing it in person. It could be an event that occurs to others and you've learned about it. This is specifically usually related to close family and friends. Or you could experience repeated and extreme exposure to adverse details and events. So with that last one, think about like first responders or police officers to event. They're constantly seeing these crime scenes or sexual abuse, things like that. That could really affect them on a daily basis. And then group B, so once you experience the event, you go into the next category, which is persistence of one or more intrusive symptoms after the event has concurred. So these intrusive symptoms can be reoccurring involuntary and intrusive distressing memories of the event, reoccurring distressing dreams related to the event. It could even be dissociative reactions, so like flashbacks, in which the individual feels or even acts like the event is happening right then and there again. Or it could be intense, prolonged psychological distress at exposure to internal and external cues that symbolize or resemble an aspect of the event. So anything reminds you of it. It could be fire reminds you of it, or like if you had an event that specifically symbolized natural disasters, anything like that reminds you of it, that it just throws you back in that moment again. And then, yeah, you get that physiological reaction when it happens as well. So any one or more of those things, that could be it. And then you go into group C. It's persistent avoidance of stimulus associated with the event. So you avoid any distressing memories, thoughts, or feelings that are closely associated with that traumatic event, or any kind of external cues. So that could be people, places, conversations, objects, or situations. You really just try to avoid them because they create that arousal of memories, thoughts, and feelings about that traumatic event for the person. And then so if you have that, then you go into group D, and it's the persistence of two or more negative alterations in cognitions and mood. So that can be the inability to specifically remember important aspects of the event, so you just don't have that placed in your memory. It could be persistence or exaggerated negative beliefs or expectations about oneself, others, or the world. So once this event happens, you really just have that kind of nobody can be trusted, the whole world's bad, kind of across the board feelings after the event. It could also be the persistent, distorted cognitions about cause or consequence of the event, and that kind of leads you to blame either yourself or others involved, and you really just don't want to, anything reminds you of it, which leads to E, which is the experience of two or more alterations in arousal and reactivity. So this is really just the persistence of negative mood, negative emotional state. You just can't be positive. You have lack of interest in significant activities that once meant something to you in your life. You don't want to participate in them. This causes a detachment or estrangement for others within your life. You kind of keep to yourself. And it's just really that persistent inability to experience positive emotions. You just can't feel happy. You're depressed a lot of the time. That kind of thing. And then a big thing for PTSD is these symptoms have to be longer than 1 month's time. So if it's right after the event and it's only been a week, you really can't be diagnosed with it unless it's an extreme case of it. These cause distress or impairment, and it's not caused by something else. Okay, so moving on to acute stress disorder, very, very similar to PTSD, just not quite as severe. So you still have to experience that actual life-threatening, serious injury, sexual violence act, whether it be witnessing, experiencing it yourself, learning about it from a family member, stuff like that. And then goes right into Group B, which is the presence of 9 or more symptoms within the following 5 categories. So those categories are intrusion, negative mood, disassociation, avoidance, arousal. So very similar things to PTSD. Kind of intrusions that reoccur in involuntary memories, dreams, flashbacks, that kind of thing. Negative mood, simply can't feel any positive emotions again, depressed, things like that. Disassociation it's an altered sense of reality. You don't remember those events. Same thing with PTSD, basically. Avoidance is you just don't want to experience those stimulus, so you kind of avoid them at all costs. People, places, things, anything that reminds you of it, you just don't go around it. Feelings of arousal, you don't participate in things that once meant so much to you, or people that mean a lot to you. You just really, positive mood is just not there. And And again, this is a longer than a 1 month period of time, but it's not a very extensive long period of time. So it's usually an in between. PTSD is usually a longer amount. Acute stress disorder is usually shorter. Simple as that, though. Very, very similar. So what causes these stress disorders? There's many factors that go into it. These include biological factors, childhood factors, personality styles, your support system, the severity of nature of the traumas to be exact. So let's go back to biological factors real quick. You've got your brain-body pathways, which is the hypothalamus. It activates your two stress pathways that we talked about earlier, your sympathetic nervous system and the hypothalamic pituitary adrenal pathway during stress. And researchers have found that people who develop PTSD react with especially heightened arousal within these pathways prior to these major stressors in their life. So this kind of gives them a predisposition that after an event happens, these pathways become even more reactive. And more so, researchers have found abnormalities within the cortisol and norepinephrine of these pathways too, which kind of leads into the brain stress circuit. They believe that there's an overactivity within the two pathways, just as I stated before, which causes major dysfunction within the brain stress circuit. And this leads to symptoms of PTSD. So these structures within that circuit include the amygdala, prefrontal cortex, anterior cingulate cortex, insula, and the hippocampus, which all kind of relate to these fear and panic circuits too within the brain. So when there's flaw, interconnectivity, and communication between the structures, that's when it leads to problems in the onset of PTSD, basically. And then lastly, they find that there's inherited predispositions within PTSD as well. So researchers believe that these tendencies for overactive brain-body pathways and the dysfunctional brain circuits causes susceptibility to PTSD, basically. And they found that through family pedigrees, twin studies, and studies done on mothers passing down genes to their offspring, that these all kind of are inherited too. So that's one of the major things that they've been looking at. Childhood factors, kind of a given. Basically the opposite of inherited. They say that it's more developed during your childhood. Children that have been neglected or abused during their childhood kind of develop these overactive pathways and carry them into adulthood. So if you're experiencing poverty, assault, specific catastrophes, even parental separation during your childhood, it's all kind of linked to these over-heightened senses within these pathways that later lead to PTSD. Personality styles. If you're that type of person that's basically super negative all the time, you've got a down attitude, your coping mechanisms aren't really there, you've got a tendency to develop PTSD more so than someone who has that kind of more structured personality style. Researchers have found that people who view their life negatively and that they're out of control develop more severe stress symptoms after events, any traumatic event basically. Going on with your social support system, people with low social support, family support, they're more likely to develop these more stressful disorders just because they don't have those people to help them there with that event. And then of course, severity of the event is going to play a large role in it as well. So if you're experiencing this great natural disaster, you might have more so PTSD symptoms than someone who's witnessing a shooting on the street, maybe. Even anything less likely than that as well. So it all just kind of depends on that person. They all kind of go together. You can have biological factors as well as these childhood factors, and everything kind of leads to it. But that's the research that they found. So, of course, treatment varies with trauma to trauma, but there is across the board specific things that therapists have found work better for PTSD and acute stress disorder patients than other things. So antidepressants actually have been found that they work very, very well in PTSD patients just because it kind of helps with that negative mood, that flat effect, stuff like that. Other than that, specific types of therapy, though, So cognitive behavioral therapy approach works really, really well for PTSD because the cognitions kind of guide veterans, sexual assault survivors, anything like that, to they examine and change the dysfunctional attitudes that they have and the interpretations that they've met. They kind of change them to help them a little bit more. So that's so known as cognitive processing theory, actually. Therapists often combine that with this mindfulness-based techniques to help become more accepting and less judgmental of their disorder and the situations that they're in. Furthering that, on a behavioral side, therapists often apply an exposure technique to their clients to reduce symptoms and help adjustments within their situation. This can be especially helpful with prolonged exposure techniques, where clients describe in pretty great detail the traumas that they've experienced too. Another popular therapy is eye movement desensitization and reprocessing, also known as EDMR therapy. Basically, clients will move their eyes back and forth really rapidly while they're kind of flooding their minds with these objects and situations that they really usually try to avoid at all costs. But there's many skeptics on this experience if it actually even works or not. So make your own judgments, I guess, on that one. Couples therapy, family therapy, these all work really, really well because, of course, your families and your spouses are going to be particularly exposed to these symptoms of PTSD in their loved ones. So this type of therapy helps individuals understand what the impact is that they're having on others and kind of learn to communicate better, improve problem-solving skills, and really reestablish feelings of closeness to their loved ones, relatives, family, friends, anything like that. And it's very, very similar with group therapy as well. People meet others that are like themselves, have experienced similar things, and they kind of get to share that feelings and those experiences with one another, and it builds this mutual support and can be very, very helpful to individuals experiencing this. Something that's used in a large-scale form of PTSD, so debriefing psychologically, or also known as critical incident stress debriefing. It's a form of crisis intervention that has victims of trauma talk extensively about their feelings and reactions within days of the event. So a good example of this is when 9/11 happened, when the Twin Towers fell. There was this flood of debriefing counselors that came in and just talked to everyone, kind of got their feelings, felt what they were seeing, stuff like that, and it really, really helped those individuals. It kind of clarifies all reactions are completely normal to the event, and then it refers any individuals with stronger feelings to long-term counseling in order to help them. It's been proven to work really, really well, and there's been training of these debriefing counselors all over the country in order to help with that. Lastly, if you're experiencing or you know someone that's experiencing any of these symptoms that I've kind of described within this video, please seek help. We do have the Albright College Camp Counseling Center located in the Gable Health and Counseling Center building on campus. If you need to, schedule an appointment with them. Their phone number is 610-921-7532. Very helpful. Definitely do that if you need it or know someone who needs it.